This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Pixaflo 2.5 tablet is an anticoagulant medication. It helps manage blood clotting in various conditions. Indications and uses. This medication is indicated for the management of blood clots that form in veins, particularly in patients with irregular heartbeats, and is useful after hip or knee replacement surgeries. It aids in preventing deep vein thrombosis and pulmonary embolism while also managing the recurrence of these conditions. It is essential for adult patients to follow the prescribed regimen to prevent serious complications associated with blood clots. How it works. It works by blocking factor XA, a crucial component in the blood clotting mechanism, thereby reducing the likelihood of clot formation. Directions for use. Take this medication as directed by your physician, swallowing the tablet with a glass of water. If you experience difficulty swallowing, discuss alternative methods with your doctor. The proper dosage and duration will depend on your individual health condition, age, and body weight, so it's vital to adhere to your physician's recommendations. Possible side effects. Possible side effects include bleeding from various areas, bruising, fatigue due to anemia, and low blood pressure. Precautions and warnings. Consult your healthcare provider before use if you have liver disease, active bleeding disorders, or are pregnant or breastfeeding. Caution is advised for elderly patients and those with kidney issues. Inform your doctor of any other medications you are taking to avoid interactions. FAQs. 1. Is Pixaflo a blood thinner? Yes, it is an anticoagulant that helps manage blood clot formation. 2. What precautions should I take? Inform your doctor about any pre-existing health conditions. 3. What if I forget a dose? Take it as soon as you remember, but consult your doctor. 4. Can it cause low blood pressure? Yes, it can lead to low blood pressure. Monitor your symptoms. 5. Is it safe during pregnancy? It is not recommended during pregnancy. Thank you for watching. If you have any questions or suggestions, feel free to leave a comment below.